No one told me that eating 6 Tide Pods would give me uncontrollable diarrhea. Sir, we're gonna have to keep you at the hospital. I've already been in for 9 hours. I know, but...
Ben, can I speak to you?
Okay, be right there. Hey, I still need help! Ben, why did you discharge Mr. Isaac in room 3 without ordering a CT scan? Because he didn't need a CT scan. He came in for a broken bone, and the X-ray confirmed that. You can never be too sure. An extra CT scan would have been more definite. Did you see the X-ray? We successfully reduced it back into place and he's following up with ortho. Yes, but then we can't opt for higher reimbursements. So just to be clear, this month you've denied my pay bump approval, you've declined my request for time off, and now you want me to opt for a line of care for my patients that will maximize profits? We like to say align proper care with the hospital's vision to prioritize profits. I mean patients. There are not enough beds or staff here to keep patients for unnecessary tests. I am doing the best I can with the limited resources you have provided me with. Ben, you're needed in room 263. I'm needed everywhere because there's not enough of me. This is what you signed up for. No, I didn't sign up for this. I can't take this anymore. I'm done. I gotta go somewhere. I need to laugh. Oh my God, you have to go to the Stephen Ho Not Your Hero comedy tour. The what? According to your symptoms, upset stomach, anxiety, depression, high blood pressure, oily skin. Okay, that's enough symptoms. You may need a dose of comedy, or at least relatability. Ooh, sounds exciting. Am I invited? No. Okay, sir, you're here for abdominal pain. I was attacked and they shoved a bottle up my butt. What? Who attacked you? That darn masseuse. Oh. Whoa, that is pretty high up there. Why did they attack you? I was getting a massage and I didn't tip her, so she shoved a bottle up my butt. Whoa, you didn't tip her? How is that medically relevant to you right now? Well, you should always tip your service workers. Who gives a fuck, man? Take it out! Hold on now, let's just think about this a minute. Are you debating leaving it in? No, that would violate my Hippocratic oath. Your what? I took an oath as a doctor to do no harm to my patients, although it never explicitly said anything about bad tippers. I'm sure it was implied! Alright. Although, maybe I'll just leave the tip in. I see what you did there. Okay, here we go. Oh, it's out. Thank you, doctor. And you know what? I've really learned my lesson. Here. 5%? That's it? No, don't do it. Remember your oath. She's an indoor cat. She's never been outside. I don't understand how she could be pregnant. Are you sure your cat has no outdoor access? Absolutely not. She sleeps in my bed. We watch HBO together. And there are no other cats in the house. It's just me, her, and her 2 brothers. Her 2 brothers? Yes. Are they cats? Of course they're cats. They're from the same litter. Are her brothers neutered? No, why would they be? They don't have outdoor access. Do you understand what I'm saying? So you have 1 female cat and 2 male cats living together. Yes, siblings. Sir, have you seen Game of Thrones? Of course, that's one of our favorites. Okay, do you remember Jaime and Cersei Lannister? Ugh, yes, those incestuous twins. Right. Are you saying my cats are sleeping together? Yes. Yes, yes, but that's impossible. They're siblings. Sir, they don't care. You're saying Game of Thrones made my cat sleep with her brothers? No, I'm saying your cats don't know any better. I knew I should have watched more classy TV. The TV is not the problem. Medical Mysteries with Bill Gates. Is this good advice or bad advice? When you have sudden onset of stomach pain, eating or drinking something will make it better.
Oh, that's probably bad advice.
Bad advice. Correct. It is bad advice. Because if your stomach is in pain, eating or drinking something will oftentimes irritate it even more. So you want to give it a rest. That's the first thing that we tell you when you come to the ER too. When you come to the ER, if you have anything that's wrong with you, we tell you not to eat or drink anything until we find out exactly why, in case you need emergency surgery. So your stomach has to be empty because it'll complicate the surgery. I've had surgeons oftentimes will delay surgery if you've had anything in your stomach within the last 24 hours. Right?
Because you could, I guess, get sick and that would be hard to breathe then?
Yes. So if you're on anesthesia, your muscles aren't working, right? Any contents from your stomach that leaks out of that tube that goes into your stomach could go into your lungs, causing you to aspirate and choke and die. Welcome to the ER. How can I help you? I have a foreign body object stuck in me. What? Where? Up my rectum. Oh, okay. Oh. What is it? Easter egg. Gotcha. Happy Easter. How did this happen? I was doing an Easter egg hunt for my nephew and I fell on them. Them? Yeah. How many did you put up there? 12. And how many are stuck? Like 5? Oh, wait. 4. Have a seat. We'll call you in soon. I can't sit. Just stand over there, man. What do I do with this? Take it with you!
So I have a history working with teenagers and kids that have psych histories, and that experience pays off in the emergency room. And like, if you can, maintain some compassion, even when they're yelling and screaming and spitting and biting and scratching, and you can keep your own emotions in check, it's pretty amazing if you can get past that and get to the other side. Because once you get to the other side, you can kind of help rewrite some of that story that's going on in their head, because their story is every time I come to the emergency room, I get restrained, give me medications, it's scary, they lose control. And if we can start to rewrite some of those stories, it's amazing. It's pretty rewarding.
We're still waiting for your cervix to fully dilate, so the baby shouldn't be coming out yet. Okay, but when are you gonna check my belly button? What do you mean? You've been checking my privates all day, but you still haven't checked my belly button. Wouldn't that give you a better idea of when the baby's coming out? Why would we check your belly button? Because that's where the baby's coming from. Isn't it? Oh, no. Is that what you think? Yes. Is it not? Okay, do you remember the night that you got pregnant? Oh, yes, very well. Great. So the place that your boyfriend went up that night is the same place the baby's gonna be coming out of now. Do you see what I'm saying? Oh my God! It's strange, yes, I know, but... I'm gonna poop out my baby? What? No! Oh, gross! Code blue! Patient's heart's not beating! Someone page the doctor and get me a crash cart! We need more blood! Ugh! Emergency room, how can I help you? Hi, I gave my son a vitamin today, but I cut the vitamin in half before I gave it to him. How do I know which of the vitamins he got? Ma'am, he gets half of all the vitamins. Really? Oh, that's fantastic. Thank you. You're welcome. Okay, sir, I need to draw some blood. You ready? I am. Yes. Here we go. I knew it! My doctor doesn't know shit! What? I just went to my doctor and he said I had high levels of cholesterol, but that doesn't make any sense because you just drew my blood and it flowed into the tube perfectly. Oh, no, sir, your cholesterol has nothing to do with the blood flow. Yes, it does. If my cholesterol was high, my blood would be chunky, like a milkshake. That's science. I read about it online. Online where? The Dairy Queen website? I love Dairy Queen. I eat there all the time. That would explain the high cholesterol. And my doctor says I need to change my diet. Who needs to change their diet when you have a perfect flow? I don't eat vegetables. Ugh. No, sir, your blood flow has nothing to do with your diet. Your blood will flow into the tube no matter how high your cholesterol is. Think of it like a Dairy Queen soft serve. Dairy Queen soft serve? Yes, it flows out the same way every time. But sometimes the machine needs to be cleaned, and vegetables help clean it. I see. Here, inject this kale smoothie into my arm. What? No, sir, can you believe this costs 16 freaking bucks? Tastes like a fresh cut lawn. Inject this into my arm directly. Health tastes terrible. No, that's not how this works either. What? Is there an option? I'm gonna call you a nutritionist. So there is? No, there certainly is not. Dang. Tips from the ER. Measles, a disease we eliminated in the year 2000. And now, in 2026, we are somehow seeing outbreaks again. Mother! It's not just a rash. It is one of the most contagious diseases on this planet. If you are not vaccinated and you are in a room with someone who has measles, there is a 90% chance you are leaving that room with measles. 90%! You just have to breathe the same air. You don't even have to touch this person. You don't gotta get close. You just have to be in the same room. And you can catch this disease up to 2 hours after the infected person has already left. What the fuck? Yeah! And for most healthy adults, measles is miserable, but survivable. But for babies too young to be vaccinated, for people with compromised immune systems, for pregnant women, it can cause brain damage. It can cause blindness. It could kill. And the craziest thing is, We had a vaccine. It worked. It worked so well that an entire generation grew up never even having to think about measles once. But not anymore, because somewhere along the way, we decided that the vaccine was more dangerous than the disease. It is not. It never was. So get vaccinated. Get your kids vaccinated. Not for me, not for the government, but for the baby in the waiting room who's too young to protect themselves and is counting on everyone around them to do it instead.